Hello everyone, I am Dr. Rubina Pandit, a fertility consultant at Nova IVF Center, Basveshwanagar, Bangalore. Today I will be talking in brief about an entity called recurrent implantation failure. Now, recurrent implantation failure is defined as a failure to attain clinical pregnancy despite transferring 4 or more good quality embryos in 3 or more fresh or frozen cycle in females under 40 years of age. So, whenever a patient presents to me with recurrent implantation failure, 2 factors needs to be evaluated. One, the embryo factor. Second is the uterine anomaly. Now, embryo factor basically depends on 2 things. One is the oocyte quality, the second is the sperm quality. Poor oocyte quality can be seen in various conditions, for example, advanced maternal age, low ovarian reserve, uncontrolled medical conditions like thyroid, diabetes, hypertension, lifestyle factors, for example, obesity, smoking, and others like genetic conditions where genetically only eggs are of bad quality. The second is the poor semen quality, which is indicated in the form of low sperm count, low sperm motility, decreased morphology, as well as increased DFI, and that can be affected by various factors like advanced maternal age. Second is lifestyle factors like smoking, alcohol, same uncontrolled medical conditions, and genetic factors. The second factor which needs to be evaluated is uterus. Now, there are various uterus conditions which can result in recurrent implantation failure. For example, uterine polyp, intrauterine adhesions, intrauterine fibroids, there can be fluid or bilateral hydrosalpinx. So, there are various modalities which can be helpful in diagnosing these uterine conditions. For example, ultrasound or 3D, 4D ultrasound, HSD, but ultimately the most important and the diagnostic modality is a diagnostic hysterolaparoscopy, because in the same setting, if there is any uterine problem, the correction can be done at the same setting. So both the factors needs to be evaluated before we move ahead with next treatment plan. In case we know that the problem was in the embryos and the patient has bad oocyte quality, but the bad oocyte quality is because of the modifiable factors, then we can give the patient about 2 to 3 months of break so that the modifiable factors get corrected, and after that we can plan one more IVF cycle. However, there is a genetic condition or inherently only there is egg quality is affected, and similar if the sperm quality is affected genetically, then gamete donation might be considered as a second option. Similarly, with respect to uterus, we have various tests like endometrial receptive assay, diagnostic hysterolaparoscopy, but after that also, in case the patient is not able to conceive, then the last option which needs to be taken into consideration is surrogacy. So whenever a patient comes to me with recurrent implantation failure, it needs a thorough evaluation, a thorough investigation before we plan another IVF cycle so that the same implantation failure does not get repeated again.